just a quick overview of what we had done earlier in the fourth learning outcome. So it's helpful to just catch up with it. So we had tried to understand the specific immune defense mechanism. So we have talked about an innate immune response, which is there already. And we've talked about one that is artificial or then that is produced because of uh, it's produced artificially because of certain other agents, such as vaccines. So we had gone through a video. You can have a link, have this link as well, and have a look at it later on. So we had talked about active and passive immunity. So active immunity was the immune response that is there already within the body, and passive immunity was that is produced as a result of antibodies being injected into you. So I'm going to go through this quickly because we've done this already. I've shown this in several videos. This is just a brief understanding of what we've done already. The components of our immune system comprised of white blood cells, there were antibodies, the complement system, lymphatics, the spleen, the bone marrow, and the thymus. So all of these are shown over here. Uh, so these are basically 7 to 8 different immune systems that work. So the white blood cells, we had said that they're leukocytes. Leuko means white. Okay, so along with red blood cells and other blood cells, platelets, for instance, we had talked about platelets also. We have B cells, which are white blood cells. They have T cells, they're neutrophils, cytokines, and macrophages and plasma cells. And apart from this, we have the humoral immunity and the cell-mediated immunity. So we had talked about the active forms, so that when an antigen, such as an organism that has um, a, a poison attached to it, let's say in that way, when that is recognized by the body, the immune system of the body, there are certain cells that are produced just to phagocytose or kill that cell, that foreign cell. So that is known as active immunity, and that is a part of our innate immunity. And we have muscle cells, sorry, mucus layers, we have the saliva. And then we had, so we were talking about active immunity when the cell is itself responsible for, the system is itself responsible for protecting us from a pathogen. Passive is then when you gain it from some other source. So that could be an infectious person who already had the infection, and that person can use his or her immunity to produce immunity in yourself. Antibodies, we had also talked about that it happens by the transfer of the antibodies that are transferred from the mother to the child, or from the in the womb. So it's the fetus that gets the antibodies through the placenta. And sometimes antibodies can cause reactions. Active immunity does not have any reactions or side effects. Passive immunity develops immediately. Okay. However, active immunity takes time in developing. Passive immunity doesn't last for long. Even with the mother's case, it's just 6 to 7 months. And it does not lead to a memory. So it's fast, however, doesn't lead to immune memory cells. Active immunity is slow, but slow and steady. It wins the race because it has memory cells also. So just remember it in that way. Um, we had said active immunity is gained through the introduction of a pathogen. Passive immunity is acquired when antibodies are introduced into the body from an external source, usually through vaccines. It produces a quick response to the infection. Humoral and cell-mediated immunity, we had talked about these two. So cell-mediated immunity is through T cells, and humoral immunity is through B cells, through antibodies. Okay, so cell-mediated immunity does not is not triggered from antibodies, whereas humoral immunity is triggered from antibodies. Um, Not going into detail, we've talked about B cells. So humoral immunity is driven by B cells. Cell-mediated immunity is driven by T cells, macrophages, and the release of cytokines. This is all in response to the toxic agent or the toxin that is there present in the pathogen. Okay, so remember, cell-mediated immunity has mature T cells and macrophages and the release of cytokines, whereas humoral immunity has B cells that produces antibodies. We have talked about all of this. So we've talked about this also. Mm, okay, so where were we? Just a minute. This is a very good site, a very good table to show you how this whole humoral versus cell-mediated immune system works. Um, so it's the humoral immunity. So we see it's through antibodies, whereas the cell-mediated immunity is through T cells. It's T cell mediated. Where does the humoral immunity arise from? It's the extracellular fluid. So outside the cells, you have fluid within your body, so it's produced from there. Whereas cell-mediated immunity or T cell mediated immunity uh, has the location of the antigen presenting tissue. So it's not extracellular fluids, it's where the antigen presents itself. What are the main cells that are involved in the humoral immunity? It's B cells that are for humoral and T cells that are for cell-mediated immunity. As I said, it's humoral immunity has a fast response upon detection, whereas cell-mediated immunity has a slower response. Okay. The antigen type in the humoral immunity is extracellular pathogen, so outside the cell. Okay, so think of this that humoral immunity has pathogens outside the cell. Okay, whereas cell-mediated immunity, because of the name it has, it is intracellular within the cell. Okay, cancer cells, just as I said to you that cancer cells are killed by T cells. Within the cells, they destroy the pathogens within the cells. How is the method of removal for the humoral immunity? It's antibody. So antibodies, as I said earlier, antibodies are produced which destroy or make it neutral. This is for the antigen or for the pathogen. The antibodies that are mediated, they neutralize uh, that virus or that bacteria, or they destroy it. Whereas in cell-mediated immunity, there is cell killing and there's a programmed death, such as death of cancer cells. What are the proteins involved? There are class 2 proteins involved in humoral immunity, whereas in cell-mediated immunity, there's class 1 protein involved. So I'll just show you a few more slides here, and then we'll go to the 5th learning outcome. I hope this is clear to all of you. I'm not going into details of the previous ones. I'll see how much detail is required for you. So I'll give you at the end, I'll give you a detailed session of whatever excess I have to teach you. So what's the primary response? If we see, so in a primary immune response, there are B cells that obviously, once there's an antigen, the B cells become stimulated. So the B cells are living there in the body. They're not activated at the time. Once an antigen attacks, that is when they activate themselves, or they're activated, and they differentiate into antibody secreting cells that produce antibodies specific for at least that antigen. So not every antigen will have the same antibody. Okay, there'll be different antibodies for different antigens. Then the secondary response, this is a primary response. Okay, they're stimulated by the antigen. The secondary response is then when the same antigen stimulates memory cells, memory B cells. These were produced in greater quantities because of the primary response. As I said, they're memory cells that are produced by the humoral immunity, whereas the cell-mediated immunity does not have this. Okay, so this is just a curve that different figures that show you a diagram of primary and secondary response. You can have a look at it from the textbook also. So these are the days that are shown. This is the x-axis, and this is the y-axis. Okay. So if at any point you find it difficult, you want me to go a bit slower, I understand it's a dense subject. What I will do is at the end, so we have our LO5 to cover. So that will be done today. I'll try my best to cover as much as I can. So when we're having the assignment discussion tomorrow, I'll give it a whole, all the outcomes. I'll present them in a nutshell, in just 5 to 6 slides, which can just give you the gist of it, what is required from you to learn. So there are these days. So we have day 0, where the first exposure to the antigen happens. And then following from there, we have the 7th day, the 14th day, the 21st day, 28, 35 days. Okay. So there are 35 days. Just not, do not think about this right now. So we're just talking about the first exposure. Okay. The primary immune response. So what happens? There's an antigen that was identified, and sorry, there's antibody produced. So which antibody is the first one to be produced? IgM, immunoglobulin M. It's the first antibody to appear in the primary response. You see this peak? This shows how much of it is produced. This is the amount of antibody. So there's a peak of the IgM. So the first antibody that is produced as a result of the first exposure to an antigen is the immunoglobulin M. So, and later on, when we proceed towards the probably 8th or 9th day, you have the IgG response. Okay, this is immunoglobulin G that peaks and then slowly decreases. So IgM increases and decreases on the 14th day, and it is not there anymore because there's IgG or immunoglobulin G to cover for that. Okay, so throughout that time period, you have the IgM and followed by the IgG response. I hope that's clear. This is as a result of the first exposure to the antigen. What about the second exposure? So this is when the exposure has already happened, and this is the second time that the virus attacks you. Excuse me. So as I said earlier, you had the IgM that was there. Okay. So, however, when you have the secondary response, you can see that before the IgM, you already have the IgG. It appears earlier uh, than in the primary response. So, if the first time that you're attacked by an antigen or a virus, you will have IgM. Whereas if this is the second time you've been attacked, you will now have the IgG. And you see the peak that IgG goes to. It's tremendous. Okay. So this is amazing for the secondary response. Okay. So this is higher than in the primary response, whereas the IgM is the same, approximately the same. It extends a bit more to 21 days and then ends there, and then is not there anymore, almost negligible. So you have majorly the IgG that is fighting, the immunoglobulin G that fights for the secondary response. Okay. So primary versus secondary response, we've talked about this already. So what happens? These are again, the x-axis shows you how many days of exposure that have happened. And then this y-axis shows you the amount of antibody, just like we did in the previous one. So this is a bit more complex, this picture. what you can do is the best understand this. If you understood the previous one, this will not be a problem. This is again showing the primary response and then the secondary response, which is a repeat infection. Okay, so this first infection, it produces you have your naive B cells which are there already. Okay, think of this as the IgM. Okay, so there's activated B cells and then short-lived plasma cells in the lymphoid organs. So you have IgM here and you have IgG, as I said to you. And these antibodies, you see, this is the antigen. This round thing is the antigen, whereas these Y-shaped bodies are the antibodies that engulf the pathogen. Okay, and then this decreases. Okay, and this produces memory cells. And then when there's a repeat infection, there's a large amount of IgG that is released compared to the IgM. Okay, so I'm not going to go into details of this. So primary versus secondary response. Just one of the few slides left, just two more slides. So these are some things that you need to remember. So the primary immune response, it's the reaction of the immune system when it contacts an antigen for the first time. Secondary is when the reaction of the is the reaction of the immune system when it contacts an antigen for the second and the third or the fourth or whenever, how many times. Um, how does it appear? It appears mainly in the lymph nodes. So the primary response is in the lymph nodes and the spleen. Okay, that's an organ in our body. And the secondary response is the responsibility of the bone marrow, and then in the spleen and the lymph nodes. Okay, so the um, memory cells live in the bone marrow, and then in the spleen and the lymph nodes, they're also involved. Uh, so the primary immune response, the first immune response, it occurs in response to primary contact of the antigen, whereas the secondary is the secondary response is because of subsequent exposure to the same antigen. So remember, it's not another antigen that will attack and then it will be recognized. No, it's the same antigen. Antibody peak reaches this reaches its peak in 7 to 10 days, as we saw earlier in the primary response. Whereas the secondary response, I said, it's quicker because it's got memory cells. It's 3 to 5 days. This has the primary response has low affinity to their antigens, whereas the secondary is highly equipped. It has high affinity to their antigens. For the primary response, it's the naive B cells and the T cells that are involved, whereas the secondary response has memory B cells. Okay, which antibodies are responsible? So it's the thymus that is mainly responsible for the primary response, uh, the thymus dependent and thymus independent antibodies. Whereas in the secondary response, it's only thymus dependent antibodies. Okay, thymus is a gland in your neck. Okay, so in the primary response, it's thymus dependent and independent antibodies. So in the secondary response, it's just those antibodies that are thymus dependent. Okay, so lag phase, how much time does it take for them to be produced? For these, the primary response, it's 4 to 7 days. Okay, it's a longer lag phase. Whereas for the secondary response, because they already have memory cells, it's shorter there, 1 to 4 days. What are the types of antibodies? For the primary response, we talked about IgM and a small amount of IgG. Whereas in the secondary response, you have a large amount of IgG, small amount of IgM, then you have IgA and IgE also. Okay, so just think about mega. Mega is IgM, IgE, IgG, IgA, MEGA. Sometimes there's a D, IgD also, mega D. But these are the main drivers in the secondary response. Okay, but there's a large amount of IgG, as we just saw. Amount of antibody, So few antibodies are produced in the primary response, whereas 100 to 1000 times more antibodies are produced in the secondary immune response. What is the strength? Sorry, what is the strength of response? The primary immune response is usually weaker than the secondary immune response. Okay, and the secondary is stronger. Antibody level declines to the point where it may be undetectable in the um, primary attack, whereas in the secondary attack, the antibody level tends to remain higher for longer. We've already seen this. Okay, I just want you all to take a picture of this just to understand the primary and the secondary response. Okay, you'll all obviously get this recordings also. I'm stopping sharing here and I'm starting to share the second set of slides. Please, I do recommend you to go through these slides once again, uh, just to strengthen your understanding of this topic.
Hi, doctor. Please, can I ask a question?
Yeah.
Okay, so sorry to send you back a little. From what you just explained to us, I wanted to find out, in practically, the primary antigens or the yes, can we say that is more or less like when someone is affected by malaria, and then the other is like when someone is affected by an intense disease like cancer. Is that it? If I'm understanding it right.
No, no, that's a different type of immunity. So, for let's say, here I'm talking about viruses, and I'm talking about, like, let's say COVID-19. Okay, you're talking about primary and secondary response, right?
Yes, please.
So for primary response, let's say you got a flu. Okay, there was a virus that was involved, let's say influenza. I'll come to malaria and cancer again. So for the flu virus, you had a primary response. So sometimes what happens, when we have a flu, it's so bad initially because the antibodies are preparing to attack it. Okay, so the antibodies are trying to recognize it and then trying to attack it. Whereas in when you have the second episode of flu with the same virus, it has to be the same virus. Okay, so that the memory cells, so when the antibodies are produced, they produce some memory cells also. Okay, so those memory cells remain within your body. That's the response of the humoral immunity. They they store some memory cells, and what happens with those memory cells is that when they recognize the same antigen, it has to be the same antigen, they then produce that response. Okay, so G is released because of them. Okay,
Okay.
immunoglobulin G, as I said, there's a peak of that. Now, what happens with malaria and with cancer? So there are different types of agents involved. I'll not say, because for cancer, there's no infection involved in it. So for cancer, you will have T-mediated immunity or T cell immunity. Okay, so it's not the B cell. The B cell will be responsible for probably malaria, but it's majorly the T cell or the cell mediated immunity that destroys. So for cancers, you always have the T cell. The T cell will sometimes involve the B cells also, such as helper cells. They want more help, so they sometimes trigger the B cells, but it's mainly the T cells that are involved for the cancer cells. Now with malaria, it's an entirely different organism. It's a plasmodium. Okay, so
Okay.
there are different set of antibodies that are produced because of it. So you see, our body is has specific defense mechanisms against specific infectious agents. So it's not like if we are infected with COVID-19 and the later on it's another infection that we are infected with, and we'll have memory cells. No, memory cells are not going to work against the other infection. So they're only going to work for the primary infection. Okay, so the secondary infection will always, so the secondary response, if it has memory cells, if they're produced there, it will only be against the primary agent, not this, not a new agent. Okay.
Okay.
So the new agent that comes the next time and it infects you, there'll again be a response, a primary response for that. That will be that will take long to produce. Obviously, B cells have to recognize it. It's a long process, but then they have memory cells of their own again. So this other infection that you got, that will also develop memory cells, and then when you get reinfected by that second type of infection, you will again have memory cells to combat that. So it depends upon which infectious agent is there to attack. So B cells are specific for only the primary response. So if there's memory cells, they'll only respond, or in the secondary response, they will only respond when they have the same antigen or the same organism attacking as in the primary response. As I said,
Okay.
yeah, this is confusing because we've gone through a lot of it. What I will do, because of time constraints, tomorrow I will go through the whole of all the, because obviously before I start my assignment discussion, I always tend to give a brief overview of what we've talked about, just as a revision, so that it helps you with your assignment. And then we'll cover all these topics again.
Okay, thank you.
I hope I answered your question. Um, it is complex, okay? So initially it is, but once you go and read it again, have a look at this video and some more videos that I had shared, it will give you a good, better idea. Now we'll talk about the last learning outcome, which is the understanding how infectious agents can be controlled, diseases can be controlled. So I hope you can see my screen. Okay, again, please have a look at these recordings. Please go back. If you don't understand anything, please come back to me tomorrow. Okay. So, as the video said to you, that there are certain drugs that are there. So, our immune system works against certain organisms, but if it can't, there are certain drugs that are there to work against these disease agents. What is medication? It's a chemical composition or a chemical compound. Uh, it's used to treat or cure illnesses. Sometimes we want to prevent an illness also to happen. Okay, so for instance, if we are going um, um, to if we're having a headache. Okay, I'm not talking about infectious agents. I'm just talking about headache. If we think it's going to turn into, for those people who suffer from migraines, I quickly take some pain medication because I feel I have this aura that I'm developing, and it's ultimately going to lead me to have a very bad headache. So before that, I prevent myself and I take medication. That's for normal medication. So then there are antibiotics. So these are against some biological agents. That is why biotics. Okay. They are for bacterial cells. So they're different types of antibiotics. So there are some that destroy the cell wall um, of the organism. This is like penicillin. There's some that destroy the nucleic acid or the DNA within the organism, such as ciprofloxacin. And the protein synthesis disruption. So some organisms, they develop they have protein synthesis within themselves. So those protein synthesis are disrupted, such as in tetracycline. Okay, so these are certain antibiotics. So they work only against bacterial agents. Okay, so antiviral will not control antibiotic bacteria. Uh, Antivirals. So sometimes we have a viral infection, we want to go to the GP and ask for an antibiotic. They won't give it to you because they'll assume it's an antiviral that you would suffice with. But sometimes, but antivirals, they don't work really well. So it's better to avoid antibiotics. I'll come back to why we want to avoid antibiotics. So antibiotics, they won't work on viruses because viruses don't have a cell wall or DNA. They don't have any of these. So there's no nucleic acid, there's no cell wall. So how will they work? They even if you keep popping in antibiotics, they won't work. So they're antiviral medications, where antiviral medications, they inhibit or stop any stages of viral um, production, okay, replication. So acyclovir is for treatment of shingles, or you have chicken pox. Okay, so it's a viral infection. Um, uh, it's caused by a virus. So that is one antivirus that you can give for the treatment. Okay, then you have antifungal. So an antifungal again will not be killing a bacteria. It's just to stop the fungus. So such as your amphotericin, it stops from producing new proteins. Or stops the fungus maintaining its cell wall, such as with you can give it with an athlete's foot. You can give antifungal medication, and then antiparasitic. This is chloroquine for malaria. Okay, so this parasite, so malaria is caused by a parasitic infection. So it blocks cellular function of the parasites. Okay, so these are different drugs that are given, different medications that are given for different infections or infectious agents. Okay, so an antiviral will only kill a virus, it will not kill any drug resistance. Sorry for that. So, yeah. So how does drug resistance develop? It's basically it's one of the most worrying conditions that happen. So the reason why I said that you do not give antibiotics, let me just have a look. Yeah, it's recording. So why don't you have antibiotics? This is the last slide that yeah. I'll then go um, for the other slides tomorrow. So what happens is if you take antibiotics, in a nutshell, that bacteria develops resistance against those antibiotics. So if you're taking antibiotics without any prescription, or you're taking it for any other reason, for fungus or viruses, those bacteria that are there to attack your body, they develop resistance. And what happens because of that resistance? Your body cannot fight against those bacteria. So again, when you want to kill those bacteria through antibiotics, you cannot do it with those drugs, okay, because they've developed resistance. So sometimes you need extra drugs to kill those bacteria. So I'm stopping sharing here. So I'll just give you an example of in the past, then there were colds that were treated with antibiotics. However, this became very troublesome because there was a lot of bacteria that became resistant. Okay, and this is why you had to have new drugs to kill those resistant bacteria. So an example of this is tuberculosis. So if you take your tuberculous drugs um, inappropriately, it creates a drug resistance against those pathogens. So those pathogens, or those uh, causing organisms, they develop resistance against those drugs, and then you will have to try other drugs to kill them. Okay, so I'm stopping sharing. Any questions till now? Are there any questions? Please have a look at these slides. They'll be shared with you. I'm going to go through the slides again tomorrow just to give you a brief overview of what we've talked already. Okay, so I hope you have a nice time. Have a nice day. I'll see you tomorrow, same time.
Thank you.
Thank you so much. Okay.
Thank
Um,
you.
please do attend the session tomorrow. It's revision and then assignment discussion. Okay. Take care of yourselves. Bye.
Bye.
Bye.